This is Dr. Steph Chaney from Living Health Integrative Medicine. And I'm going to be doing a series of relatively short webinars regarding parasites. And I'm going to start with just talking about what a parasite is. And then the upcoming videos will address the symptoms that parasites can cause in the human body, what kind of diseases they can contribute to, how to know if you have parasites, how to test for them, as well as their relationship with regards to chronic inflammatory response syndrome, otherwise known as CIRS, or biotoxin illness, which most people think is only associated with mold or sick building syndrome, and then options for treatment and how we test for them and some of the best ways to test for them. So we'll just start with what is a parasite? So parasites are tiny organisms, relatively speaking, that live inside or outside their human host. So they can be on the skin, kind of like scabies or fleas, or they can actually be internal, which most of them are in relation to a lot of the chronic issues that people deal with. They essentially feed off the host. They use the host's resources, which can sicken the host. It may even get to the point of killing the host. Tens, if not hundreds of millions of people every year around the world die because of parasite infestations. But many, many, many billions of the population around the world don't die from the parasites in an acute sense. They may be hosting a parasite for decades and decades and suffer from many chronic ailments related to having these parasites because of the toxins they secrete, the nutrient deficiencies that are created, and the other secondary effects with regards to how the immune system deals with and responds to these parasites and their toxins. And so people just may be living chronically sick for many, many years without realizing that their illness is related to a parasite. So most of the time, what constitutes a parasite in most people's minds and in conventional medicine and in holistic medicine are single or multi-celled organisms such as worms or protozoa. But we have other things that can parasitize off of us in terms of utilizing our resources and surviving, not to our benefit, and actually create a lot of chronic illness while they are doing so. And that includes bacteria, yeast, fungus, and viruses. I'm going to talk more about what the other parasites are. Most people know what bacteria are. We're pretty savvy with regards to that. A lot of patients are also suffering from chronic yeast and fungal issues. And so they understand what that is, including things like candida. And everybody at this point in the game understands what a virus is. And but so I'm not going to get too much into the virus, yeast, fungus, bacteria aspect of parasite, but we're going to talk about the single and multi-cell organisms that reside in us that really our current medical paradigm in the United States, North America in particular, doesn't really acknowledge too much or address unless it's just a really unusual, crazy case. So let's talk about the different types of parasites. There's 4 main classifications, generally speaking, and I'm not going to get into, textbook detail of every single parasite. I'm going to talk about the main categories and the common ones that we're aware of. But there are literally thousands and thousands, tens of thousands of different types of parasites within each of these classifications. So the single-celled organism, the protozoan, this is literally exactly what it is. So it's a parasite. It's a much more advanced organism than just a bacteria or yeast. It has more of an organ system within its cell, but it is one cell. So they are microscopic. They can get into our cells, such as the case with malaria and babesia. And these cause a lot of issues for people. And then the next category is a nematode. Nematode is a roundworms, and these can be microscopic threadworms. Filarial is another term for that, all the way up to, foot long, large worms, much like you might see in terms of earthworms that come out in the spring. And then we've got the cestode, and this is the tapeworm. People have heard about tapeworm. They pretty much understand that might come mostly from undercooked pork or meat. That's definitely one source of tapeworm. And a lot of animals can get them from flea bites. And so we can actually get exposed to them in different ways. We'll get more into how we can get all these things in another video. And then we've got trematodes, and trematodes are flatworms. They're also called flukes. So instead of a round body, it's more of like a leaf shaped. And they, again, come in all different shapes and sizes. There's tens of thousands of different types of flukes out there. And they can be microscopic blood flukes, and they can be quite large, actually, in some people. Liver and large intestinal flukes. So the protozoa, these are the single-celled. Some of these names now will sound familiar to you. Giardia is one of them. Giardia is one of the most common causes of something called traveler's diarrhea. Causes incredible gas, bloating, diarrhea in people when they get Giardia. Malaria, this is transmitted usually through mosquito bites. Entamoeba histolytica is an interesting parasite. This is a single-celled parasite, mostly found in the enteric system, which is our intestines. But they have been found also in dental infections. So they can be found in the mouth as well, and can cause a tremendous amount of trouble. Leishmania is another one, and Toxoplasma gondii is a common parasite you might have heard of that you can get from cats through their feces. And it's estimated that roughly a third of our population almost in the United States is a carrier of this parasite, while many people don't express the severe symptoms, which could be schizophrenia, psychosis, Alzheimer's, dementia. They may be obviously causing other types of issues, or maybe the symptoms are subtle enough that you get diagnosed with something and treated for something neurological, when in fact you actually have this parasite. This is the parasite some of you guys might have heard, where they warn pregnant women to not clean out the kitty litter, because it can actually result in termination of the pregnancy or miscarriage. So that's an important one to know about. Nematodes or roundworms, these are extremely common in North America. And I know that most people think of these, when we start talking about worms, they think of the tropics, the subtropics, Asia, India, Africa. Like somehow these worms exist in every other country except for the United States. And that is completely not true. So we've got pinworm. Some of you guys might remember pinworm. I do have some patients that are young enough, wink, wink, old enough to remember actually passing them as children. And we've got hookworm. These are interesting little worms that will reside in the small intestines, and they do exactly what they say. They hook right in, and they're one of the most common causes for anemia. So, and that's a iron deficiency, blood deficiency anemia, because they're little blood suckers that hook in and essentially suck your blood. That's what they feed off of. Ascaris lumbricoides is one of the largest. It can be tens of inches long. It can be it can get very, very long. And they like to reside in the small intestines. We've got threadworms, and there might even be, threadworms can be extremely long, but they can also be microscopic. They're called filaria when they're microscopic, like a filament or a thread. So they're very, very tiny. They can be found anywhere in the body. And then we've got strongyloides, and these guys can get in from various methods as well. Their larvae can actually get in right through the feet if you're walking barefoot on a beach. And I happen to have personal experience with some of these as well. The Trematodes or flukes, otherwise called flatworms. We've got various flukes that are named after the body parts they generally will like to reside in. What's interesting is that regardless of how they're named, for example, the lung fluke, sometimes these parasites make a wrong turn when they enter the body, depending on how they get into the body, whether they get in through eating some contaminated food or whatnot. And in some cases can actually, because of their microscopic size, especially in immune compromised people or people that have issues with leaky brain, leaky gut, they can get into the brain and actually cause problems. So lung flukes may not just reside in the lungs in people. We've got liver flukes. Their larvae will have to come through the gallbladder in order to get out. And there are documented case reports published in the literature talking about how gallbladders that have been taken out actually have been found to contain the larvae of these flukes, as well as the stones themselves. In some cases, when they've been cracked open, they've found the larvae of these flukes in the stones themselves, which begs the question, why are we removing so many gallbladders instead of potentially treating for parasites? Blood flukes, these can again travel throughout the body and end up in lots of different places. And then intestinal flukes. And so these flatworms will like to stay up in the small intestines, but again, they can get into other areas, especially if they're being challenged in the intestinal area. So the next video I'm going to do is going to discuss how we get these parasites, because there's several different types of parasites that get into us through several different methods. And it's good to know where and how we get these so that we can take better preventative measures, or just be aware in general that it's not that uncommon. And you can shower every day and wash your hands on the regular, and you still may have a chance of getting or picking up parasites.